So today I wanted to talk about a common condition that people can run into, which is either a bone contusion of the toe or a fractured toe. So often people will bump or bang their toe in the middle of the night, and if you break it and it's pointing out, well, that's real obvious, okay? So yeah, if you see your pinky toe angling way over to the side, you've broken your toe, okay? In that type of situation, you'd want to come in and we'd take x-rays to show that the toe is broken, and then we would numb you up. Now, some people at home will grab the toe, pull it back into place, but yeah, that hurts without the numbing medicine. So usually you'd want to come in, we get x-rays, we numb the toe up, then we put it back in place, okay? As far as with a bone contusion, what it is just a bruise in the bone. So sometimes there's not an actual break in the bone is just bruised. Now it'll still take 4 to 6 weeks for it to get better, just like a break, but it will hurt for 4 to 6 weeks, and often we'll treat it the same. Now with a break, you have to come in to get x-rays in order to be able to see what the bone looks like. But I've drawn out here on the foot what the break would look like, and it's basically there's this black line that goes in between the two pieces of bone, and sometimes the bone will shift to the outside or to the inside, and it's what we call a displaced fracture. Well, when it's displaced, we have to numb up the toe and put it back in place, so we do what's called a closed reduction. And so we grab the toe, we pull the toe, put it back into position and alignment. Like I said, we would numb you first, so you don't have to worry about that, and that way you don't feel the pain like if you tried to do it on your own at home. Now, after we've put it in place, the idea is to hold it in place. So what we do is we'll buddy splint the toes together. So if it were the second and third toe, you would buddy splint the second and third toe together. If it's the fourth or fifth toe, you buddy splint the fourth or fifth toe together. So what you do is you get Coban, which is just this self-adhesive sports tape in the drugstore. You can get it at CVS or Walgreens. It's the same stuff that they use when you give blood to hold the bandage in place. And you tape the fourth and fifth toe together. Now, often it is unable to stay in place on the fifth toe because of it being so short, and it'll just slip or slide off. So what I recommend doing is securing it to the front of the foot. So what you do is you grab the tape and you just wrap it around the first metatarsal head and around the fifth metatarsal head, which is the bone on the outside, and that just pulls and holds the toe into good positioning and alignment. Now, we usually will want you to come in so that we can take x-rays and make sure that the toe is broken, but often people say, oh, I just broke my toe. What does it matter? Well, there is a bone behind the toe called the metatarsal, which if it's broken would be a whole separate issue. So you want to come in order for us to be able to get x-rays and verify that the fifth metatarsal bone isn't broken, because that is the weight-bearing bone, and as you walk, it'll put pressure and weight and cause the bone to shift or move, and just having a surgical shoe usually wouldn't be enough. You need a big giant fracture boot and other things. So I recommend if you are having pain down around the toe or you think that you've broken it, to come in to find out, is it broken? Is there a bone contusion? Is there a break further back? Okay. Now, after you've buddy splinted the toe into good positioning and alignment, we'll recommend putting you in a surgical shoe. And a surgical shoe is just like walking on a hard wooden board or plank because it doesn't bend. Okay, you can't get it to bend or move. And the idea is that in regular shoes, your toes are designed to be able to flex and bend and move up. Well, as the toe bends or moves up, that puts pressure on the fracture site and causes it to shift or move out of place or position again, and you want to hold it in good positioning and alignment. So the surgical shoe and the buddy splinting try to hold it into position while the bone heals. Well, I tell people that you have to think of the bone as a plate that's been super glued together. If you test it too soon, you'll pull it all apart. And so what you want to do is give that glue time to set. And it usually means wearing the surgical shoe for 3 to 4 weeks and doing the buddy splinting. Now, it takes 4 to 6 weeks for the bone to heal. And at 4 weeks, that's usually a child will heal at 4 weeks. As we get older, it'll take 6 to 8 weeks for the bone to heal. And in the elderly patients, often it can take 2 months to 3 months for the bone to heal. Now, we'll just have you decrease your activities during that time, so you can't do any running, jumping, golfing, heavy lifting, anything like that. Okay, so we have you wear the surgical shoe, do the buddy splinting for 3 to 4 weeks, come back in, get some x-rays, and then we give it another 3 or 4 weeks, come back in, get some x-rays, and then you're usually good to go. You can get active, get back to all your usual activities. So if you've recently injured your toe, or if you've been having pain down around your toes, you'd want to come in, have us check it out, get some x-rays. It's always better to be safe than sorry. Even if you don't see bruising and bleeding, it doesn't mean that you didn't break your toe. When there's bruising and bleeding, it makes it obvious, makes it easy. You come in and we can take care of it. So I tell people, come in, see us. We're Watkins Foot and Ankle Clinic at 352-805-4317.